Welcome to the Lenica Health Podcast, where we dive deep into the world of mental health and explore how technology can help us improve our mental well-being. Lenica is a digital mental health platform that combines data from wearable devices, neurofeedback technologies, and virtual reality experiences to support better mental health outcomes. Join us as we speak with experts in the field and hear stories from real people who have found solace and support through digital mental health resources. We believe that mental health is just as important as physical health, and we are committed to breaking down stigma surrounding mental health and advocating for accessible and effective mental health care. So sit back, relax, and let's start the conversation about mental health in the digital age. In today's episode, we're excited to be joined by the CEO of HealthGauge, Randy Duguay, as we discuss the power of wearable technologies in monitoring and improving health outcomes. HealthGauge is an advanced biometric wearable watch that uses artificial intelligence to gain accurate health data wherever you go. HealthGauge is collaborating with Lenica, integrating its comprehensive data capabilities into the mental health platform. Welcome, Randy.
Oh, nice to be here. Thank you.
So, Randy, tell us more about HealthGauge and what impact you want the company to have.
Sure. The thing that goes through my mind on solutions like what we're creating is the first thing is to realize that we're really creating a platform solution, an infrastructure, which in many ways I use the analogy of Uber. And Uber is an example of what's going to be happening in digital health solutions, and what we've created is that people have an existing state of being, and that includes, of course, mental health, but also their physical health and well-being. And importantly, they're looking to get to a better place or to live in a better way. And so when we think about that analogy of Uber, you start somewhere and you're going somewhere. And so health and health solutions has actually been lagging for some time. And so wearable technologies, many people look to wearable technologies and are expecting that they're producing really high quality biometric and personal health information. But what they don't realize is that most of them don't. And further to that, the underlying platform solution and how they're understanding their health information and how that information is actually being shared with their care team, which includes family, friends, and selected providers, is not well developed. So HealthGauge actually provides a solution that addresses that particular idea in helping people arrive at positive health outcomes.
That's fascinating. And so tell us a little bit more about not only how HealthGauge started, but how you see it integrating into current health systems.
Yeah, so you use the word system there, and I've been a technology and innovation character for going on, over 25 years, and so we have to just unpack that word a little bit. And so the system that we have today around health and understanding our health or being provided services has a lot to do with I get sick, I go somewhere, have really high quality professionals that serve in helping me understand whatever problem I might have, and they do a great job. But what is also happening is that there's a lot of issues around accessing those service providers. And technologies, too, are impacting on how people want to access and address their health services. Of course, we will always have highly qualified professionals that are doing diagnosis and serving in treatment and therapeutic needs. Our solution is really intended and designed to augment and support those interests as people are looking to use them. So that's what we're building.
So there are current systems that are being utilized in healthcare right now.
Yeah.
How do you see HealthGauge augmenting or working with those current systems?
Mm-hmm. Okay. So just going a few years ago, again, looking at how the health system currently generally works, no health data is actually collected until I end up in a clinic setting, or maybe I end up in a hospital setting. And then all of a sudden, my health status is updated, records are taken, maybe some treatment notes are provided, and I end up in a care pathway of some kind. So it's a very formalized, very structured, and a very well thought out process in addressing a health need. But the world is constantly evolving. And so as new technologies have progressed, and in our case, we use a lot of advanced solutions such as the sensor solutions, the biosignal capture, the ability to collect full biosignals that have the same kind of quality capture opportunity as that exists in hospital settings. And people can access these now from their local electronics store. Now that's great, but is it enough? And the thing that we're really doing is we're looking to make sure that as we collect that information and as we process that information and as we interpret that information, that it's being done in a very, very careful and accurate way. Now, we aren't necessarily looking to do full diagnosis with these signals because we really think it's incredibly important to engage healthcare professionals in the use of those signals. And so the partners such as Lenica Research and what you're doing is incredibly important to us because you access or you provide a means for healthcare professionals to use solutions that can leverage all of those data assets. So fundamentally, again, looking at that Uber metaphor, helping people address their journey as they go through life and how they engage their healthcare professionals. It's not just about having a telehealth solution, it's actually about having a solution that is constantly able to engage people with the best information that exists.
Absolutely, and I think like following COVID, the need for those virtual care solutions or the need to be able to collect that comprehensive data has become more obvious in terms of how we're going to be moving forward in the healthcare system and how we're going to be supporting, as you said, patients or individuals on that journey to wellness. So what are some barriers, I guess, potentially that HealthGauge is seeing, or what are some barriers currently within the ecosystem that the technology is facing that you're working on overcoming?
Yeah, that's a really, really good question. And some things I think we have to really pay attention to, and certainly we do. A lot of people are presuming that some of these devices and wearables, some wearables, I won't mention which ones, they really aren't doing as much as people might think they are. So conceptually, there's some that think this idea, well, if I take 10,000 steps in a given day, therefore I will be more healthy. It's a little presumptive, because there's more to the individual current state of health than simply doing those things. Of course, these are positive things to do, but there's a lot more to it than that. So so in the question of barriers, it's not so much to me the matter of what are the barriers as the matter of understanding how can we make really easy to use, understandable solutions that are able to collect solid personal health information, and such that they also can share that with their care providers in ways that make that both meaningful and actionable. So it's less so about the barrier than making sure that we're creating the right kind of infrastructure that generally and overall is serving those needs. So for HealthGauge, we're not going to have a healthcare professional team. We are fundamentally a technology and software company. So we're really serving those organizations that are looking for and working with companies like ours to address that kind of outline.
I love that you talked about the 10,000 steps, because I know like my mom, she is committed to a 10,000 steps. And even no matter how cold it is, she'll drive to the mall, make sure she gets her steps in, and she's one of the most committed people I know. So it's interesting to know that there are other metrics that are important to be considered, especially when we are looking at the overall picture for a person's health.
Yeah.
And so we know that people are generally interested in their health, but there are also people that are interested in seniors' health, for example, or healthy aging. And for us, I know at Lenica, we are interested in healthy mental well-being as people progress into their more wiser years of life. Can HealthGauge also be able to support with, I guess, facilitating or promoting better health outcomes for seniors as they continue to age?
Well, I think you know the answer to that, and of course that's really true. And but people are going to be in different places. When we talk about the state of being for seniors, it's not really about the age of a person as much as their state of being. And so one of the really serious things that as we age that that adds a challenge is facing cognitive decline. But there are things that are possible in using technology to help serve people when they might be facing the early stages of whether it's chronic health conditions or mental decline or challenges. And more importantly, again, is that there's a means for people to be served on an ongoing basis, or an easy way to do that. So and that isn't fundamentally just about, of course, the wearable technologies, but it's really about how people are engaging together in being served and supported. And so yes, all of these technology solutions are going to be applied, and our opportunity, of course, is to make those as easy to use as possible.
Absolutely, and even like one of the things that, however, how we see HealthGauge fitting into this potentially is that a lot of seniors might have like a monitoring device like to monitor their falls, right? And if they've got other health conditions, there might be an amazing opportunity not only to monitor when a senior falls, but to see how the quality of sleep is, to see their levels of stress, to see their blood pressure. And when we talk about some of those metrics, you were saying that HealthGauge, and I know that HealthGauge sensors are much more accurate, but can you talk a little bit more about how that remote monitoring might be very effective in supporting people's overall health or overall health journey?
Yeah, for what we're doing with our solution, the HealthGauge software assets and the monitoring devices, is we're actually working on a number of what I call research and development initiatives and clinical research and development initiatives. Here at the University of Alberta, we have a new initiative with the University of Calgary that is a Japan collaboration with Osaka University, and others like that, Trinity Western looking at performance athletics. The thing I would say to this is that these technologies, the wearable technologies, and frankly environmental technologies, and things that your company is also adding to the data sources, is going to help address like understanding people in ways that wasn't possible before. And so it's really great for us to be able to support those clinical researchers. And I think one of the great benefits for what we do is we do make our raw data sets, full raw data sets, accessible, so that those researchers can create their own algorithms and do studies in these formalized professional projects. And so we're supporting a number of those because we see this as a very expansive area that can provide a lot of value to people. So that's what we're doing.
Yeah, and we find that super exciting because we do know that there is that connection between mental health and physical health. And typically whenever there is a mental health assessment or when people are being supported in their mental wellness, the physical component cannot be easily monitored because it requires a lot of resources. But HealthGauge has got that potential to provide that information in its raw form, so it allows, whether it's clinicians or researchers, to be able to manipulate that data. And I think from Lenica's perspective, we're excited to be able to combine HealthGauge data with our virtual reality experiences as well as our neurofeedback technologies, because that will be very powerful in terms of being able to provide comprehensive information on that patient's journey.
Yeah.
A question that will probably come up, or people that are thinking, is there are other wearable devices like Apple Watch, Fitbit that are out there. How is HealthGauge different from those devices?
So I've been doing this for a while now, and certainly I've worked with many companies, including Apple and Google and Microsoft and so on. And to me, the good news is that we're seeing a lot more attention brought to bear on how these devices should be designed and built, how to collect and capture high value biosignals. And so we really are pleased to see these competing organizations or these amazing companies contributing to the understanding and the importance of it. For HealthGauge, we've always taken the perspective of not so much the device per se as much as it is about addressing the problem. And so when we look at a lot of these companies, I mean, they have tremendous capabilities. But for us, it's really about addressing the problems and how that data might be not just captured but utilized. And I want to really highlight, when we talk about the problem and being an innovator around solutions such as what we are working on, is that we really are trying to help people, understand their status, but more importantly, to look at behavioral change. Because most of our healthcare interests, we can certainly, when we have serious issues, there's medications, there's therapies, and that will always be the case. But it's incredibly important to think about how can we make sure that our solutions are actually helping people understand and adjust behavioral change, and then how their care team providers can contribute to that. And so that goes beyond the episodic and acute care systems. And so we're really looking to reinforce these ideas around preventative and post-event management, not in opposition or contrast to what healthcare providers are doing, but in support of it. And to do that both at a very personalized individual level. So as we look at all the technology companies out there, we welcome the continued expansion of understanding around how these companies are also adding to it.
Absolutely, and I love when you're talking about the problem, because I think there's different problems from different perspectives, but one of the problems that when we're talking to clinicians in the mental health space was adherence, in terms of getting people to either continue doing some form of therapy when they go home, or for people to be able to be motivated to continue doing the things that they need to be doing for them to get better. Do you see this information collected by HealthGauge, the integration into the Lenica platform, being also a way to support that adherence for therapy if they can see their data on a more continuous basis?
Yeah, I actually think that's an imperative. By themselves, when we look at some of the, I would call the evolution of technology, and again, I've been doing this for many years. Technologies come and go. The ideas, that we work with are not necessarily new, and so we don't want people, just acquiring wearable technology or applications. The only way that we're going to help people improve on addressing their health outcomes is if we're reinforcing that some way. And, and we see, so certainly we're seeing a lot of really amazing work going on in artificial intelligence, the discussion around ChatGPT, which we're also innovating around. But there's always, in my view, a person that is at the center of this. And the best case scenario always involves supports as needed and reinforcing that. And we all will have our own personal health journeys that we can relate to that. But when I think about my health current state and my things that I'm addressing for myself, having healthcare professionals utilizing the tools that are available makes a big difference, and that's going to be centered to how we were working on our solutions.
So you said a few exciting things that I would like to piece down. The first, I think, when you're talking about your own health journey, it sounds like having that wearable device allows a patient or an individual to feel like a more collaborative partner in terms of improving their health journey. which that excites me because I also want to know and have some level of control in terms of how I'm improving my health and how I'm progressing towards my outcomes that I want. But the other thing you touched on was you're working with ChatGPT, and everyone is talking about ChatGPT. I know it's a language processor, but people use the term artificial intelligence. Mm-hmm. How is HealthGauge working with that system?
Well, how are we certainly how are we looking at it in the future of this technology? So, and I get this question a lot more, of course, as anyone in technology space is. And the first thing I want to say is it's clearly a momentous achievement that we're seeing in these kinds of technologies. And ChatGPT, in a matter of weeks, they had over 100 million accounts created and playing with the solution. And amazingly, this is still just early stages on a solution like this. But for anybody that's worked with, just testing it and trying it, would recognize automatically that is a very powerful solution, and it's going to have a long-standing impact on the world. So for us, we're certainly looking at the idea of like extending around these health coaching solutions. These are early stages still, so we're not introducing a product at this point. But we're definitely doing some testing work, and we're doing some development work, and it's what companies like us do. But still, we're going to have a very specific kind of orientation in how to work with a solution like that. And fundamentally, it's going to be people-centered, and it's going to be done in a very thoughtful and careful way in how we bring those solutions forward. So I'm not developing like what is ChatGPT. People can go learn about that themselves. But it's going to have a powerful impact on every industry, including health.
I can definitely see that.
Yeah.
And so, when people want to access HealthGauge, how do they find you? How do they learn more about you?
Yeah. Well, like everybody, our website is healthgauge.com. We have a number of social network connections, and you can learn about our products, our solutions approaches, and more about our projects and our R&D projects, which we're really excited about this year to be working on, including working with yourself at Lenica Research. I mean, I think what you guys are doing is world leading, and it's got a lot of opportunity.
And we're also excited to be collaborating with you, and the data that you are collecting and you're sharing, it's the implications in the mental health space. I think people know about it in theory, but the application as we kind of progress this platform and with your technology as well is very, very exciting.
Yeah,
so
pleased to do that.
So thank you very much for this time. We have got Randy Duguay from HealthGauge joining us for this episode. And if you want to learn more about them, you can visit www.healthgauge.com, or if you want to learn about the integration on the Lenica Health platform, you can visit www.lenicaresearchgroup.com.
Great. Thanks, Simba. It's a pleasure to talk with you today.
Thank you for your time.